FamilyAffaires.com contributor, Dr. Dan Gottlieb. Good morning.
Thank you. Good morning. It's good to be back with you.
It's great to see you. How are you feeling today?
Okay, good.
Dr. Dan, recently we've noticed that one of the most searched topics on our site is mental health. And our audience is interested in learning about depression and anxiety disorders. So I'd like for you to speak about that today. And a couple of questions that I want you to think about while talking about it is, is an anxiety disorder and depression the same thing? And if they're not, what is the difference? We have so many people out there that are being treated. I think more and more doctors are doling out medications for anxiety, for depression. So let's educate our viewers.
Okay. So, anxiety and depression, they are first cousins, same church, same pew, they're sitting next to each other. Right? So it's very, very common to have both anxiety and depression. There are depressions that don't go with anxiety, and not all people with anxiety are depressed, but the vast majority have both. Medications, antidepressants are a godsend for moderate to severe depression. For mild depression, garden variety depression, sadness, doesn't work. It's not effective. Psychotherapy alone is more effective for that. For anxiety, medication, anti-anxiety medication, even benzodiazepines, they're potentially addictive. They're very effective for symptoms of anxiety. Unlike antidepressants, anxiolytics, anti-anxiety drugs, don't get at the underlying causes of depression, of anxiety.
Anxiety. So what would be a symptom of anxiety?
You don't know?
I know, but I don't think everybody knows.
I know. I think everybody knows.
Because you're the expert.
Symptoms are increased heart rate, avoidance, fear that triggers ruminations in your head, and storytelling. I don't want to go into too much detail because I'm making myself anxious.
Okay.
But we all.
We all experience anxiety at one time or another.
And many of us have experienced panic attacks at the same time. And that's when you're just in this panicky loop and you can't get out of it. I had one during a recent hospitalization. I was having difficulty with my heart. It went into arrhythmia. So my heart rate went up, my pulse went up, which made me feel anxious, and I became very anxious. My heart rate went up further, and I was in this loop that I couldn't get out of. I tried mindfulness, but
that's difficult.
It's like when you're in a tsunami.
Right.
You don't reflect. So I had to take medication. It was very effective.
Okay.
It broke the cycle.
Usually you hear about depression runs in families. Is that typical?
Mm-hmm. Yeah, there's a genetic underpinning. Now, we experience trauma, we get depressed. You experience a traumatic loss of a loved one, you get depressed. Now, we can't get, I might be on a bit of a tangent here, but we can't get normal grief confused with depression. And one of the things that troubles me a great deal is that we are starting to label grief as depression, and worse, we're starting to medicate it. And grief is something you have to go through to heal from the loss. And it troubles me a great deal. I mean, these depression and anxiety are painful, uncomfortable moods, but sadness, some anxiety, welcome to the species. I mean, we've got a lot to deal with, we humans, but if it's a clinical depression.
And that's where I think a lot of people are getting confused. Because I think people are losing sight of the fact that you can feel sad, you can feel down for a day, for maybe a week. I think, isn't it that if this goes on and on for weeks, then there may be some issue. But if there was an occurrence in your life that caused sadness, it's pretty normal that you're going to feel down.
Right, exactly. So if you have a depressed mood that stays with you for a while, if it interferes with your functioning at work and home, if you find yourself having your sleep impaired, either insomnia or what we call hypersomnia, if
You're sleeping all the time?
Yeah, if
Okay.
your eating changes, so your weight goes up or down 5%, these are things. If you feel hopeless, if you can't experience joy, all these things are a clinical depression. They're a brain disorder, and they need to be addressed quickly. We've got to take care of our brains, but don't get them confused with normal sadness.
Well, thank you for clarifying that. Great information
You're very
today.
welcome. Take care.